Hello and welcome to another episode of the Melbourne Athletic Development Podcast. As always, this episode of Lateral Think is brought to you with the support of Strength by Numbers. Strength by Numbers have created an integrated clinical and sports performance system. The AXIT system uses force platforms, dynamometry and strain gauges to objectively measure everything from isolated movements to sports performance tasks. The system has greatly enhanced our clinical practice, decision-making and objectivity. We are no longer guessing. The greatest thing is its ease of use, both for practitioners and clients. There are no wires, no fixed setup. It is a fully integrated Bluetooth system. If this sounds like something that would enhance your practice, visit strengthbynumbers.com and tell them that Melbourne Athletic Development sent you. Thanks for joining us again, Jack.
Happy to be here, John.
I don't know about happy to be here.
Ecstatic, then.
Good. Alrighty. Today you wanted to talk about monitoring load.
Yep.
It's something that has become really popular, particularly in the sports medicine sphere, since Tim Gabbett started publishing a lot of papers on load and acute to chronic workload ratios. Mm-hmm. Obviously, managing, monitoring, and utilizing measures of whether it be training load or exposure to stress has been around for a long time. So the concepts, obviously, that he's bringing are not new, but it became really popular, particularly in the health world around then. And I think a lot of stupid things happened at that point.
Such as?
Well, what seemed to happen is everyone started to think that load was the only reason that people were having injuries, and they were trying to use load to predict injuries. And I think we saw this in the frustration of someone, what's the Italian bloke from...
Impellizzari.
Yeah, Franco Impellizzari lost his shit and was like, this is fucking bullshit.
Yeah.
The statistics on this are not necessarily even that accurate. They've used this kind of statistical modelling, and even though if theoretically what they're saying has a lot of merit, you can't apply it in an absolute sense in the way that they're doing.
Yeah, and I think that's a good point to highlight where putting aside some of the critiques of how the research is done, thinking about the issue of, even though they see on average there is this response, how do we capture individual variability? Because the reality is, and we should talk a lot bit more about this, is the response to training varies greatly. And more importantly, when you think about what we're trying to do when we monitor is get an idea of someone's readiness and someone's recoverability. Now, when you think about the mechanical load someone is exposed to, that's one component that will determine the physiological response and the amount of stress that someone's undergoing, but it's certainly not the only factor.
Yeah, I actually had this conversation yesterday. I caught up with a mentor of mine, like in the coaching sphere, and like it's quite interesting because we spoke a lot about the dynamics of that and how it's so heavily influenced by factors outside of, as you said, the mechanical loads that are actually experienced. You know, like I always bring this paper up, I know, so I apologise to our listeners, but you know, the work by Brian Mann looking at academic stress and increase in periods of high academic stress and what happens with injuries. And so what I was talking to him about yesterday is one of my athletes is actually completing his CA, like the Chartered Accounting work as part of his postgraduate kind of accounting stuff. And, you know, he gets really stressed about the fact that he's got these exams, he's got these, and they're quite, from what I've been told, I don't know that much about accounting, but they're quite challenging subjects. And he kind of gets stressed about it. And yesterday he was really saying, I'm really tired, I feel really this. But if we actually looked at his training loads, if we looked at managing those things, we've actually been doing less than what he would normally do. And the intensity's actually been pared back because of the understanding that his body responds really interestingly to that.
Yeah, and look, when we start to think about what's the actual rationale for that, it's not something that's trivial. It's something that's actually quite clear in terms of understanding these mechanisms. And I think too, when we think about non-physical factors, clearly a big one is psycho-emotional stress. And I think we've talked about this before, but one of the other things that's really clear is when you experience or you feel like you're under a lot of psychological or emotional stress, whether that be related to work, whether that be related to family, social factors, whatever it may be, your process of recovery from training is prolonged. And part of that is because of the regulation of your immune system based on your psychological state.
I think people would, like, they'd probably not argue with this, but they'd be like, okay, well, what are you using to kind of measure that? And interestingly, there's the really obvious one of like looking at their demeanor, looking at their performance, seeing what their function is like, how well are they able to then take on new skills or challenges, and that goes down, right? But that's subjective, and that's something that you're observing. The thing that's been really interesting is, I think I've mentioned this before, but with a lot of the athletes that I coach for track these days, I use a system called a Megawave, which is developed in Finland, and it's a great system. The really cool thing is it's become really clear that the correlation between what they're getting in their scores on there, as in comparison to what they're telling me, seems to have really good matching, right? And the most interesting part about it is the worst scores that they get are always or have typically been related to psycho-emotional stress, not from physical stress. They tend to bounce back a lot from, say, high training loads if you give adequate recovery and you structured your cycles correctly. The thing that seems to prolong poor measures and poor performance and poor reporting of what they feel seems to be psycho-emotional stress.
So I think it's probably worth giving context to listeners. You know much more about it than I do. Like, what does it actually measure?
Okay, so the Megawave system measures a few things, but the key ones that people would be aware of is it uses an ECG strap to kind of get an idea of not only some of the more common measures like heart rate variability, that allows you to obviously get some insight into the function of the autonomic nervous system, whether they're tending to be more towards parasympathetic or sympathetic. It also looks at things like their resting heart rate. It'll give you an idea of, and the way that it does that is by looking at, not only those intervals for measurement of heart rate variability, but actually the shape. I don't understand all of the mechanics of ECG sort of readings, but I was listening, and I think you listened to it as well, the founders of it talking about, and the scientists behind it talking about how they actually, even at one point, they were able to find ECG findings that were, say, quite abnormal and then report it, and that athlete ended up having issues relating to like tachycardia and all this kind of stuff.
I actually didn't know it.
It was in one of the talks. He was talking about how actually you actually have a heart issue, and the system picked it up.
Yeah, wow.
So it's like your rhythms are actually not matching what someone we would expect to be, particularly in the shape of the ECG reading. But essentially, so it gives you all those, the overall system function of the cardiac system.
Yeah.
But for me, working with speed power athletes, that's actually not that relevant. And it's really interesting because, again, in one of the discussions that the founder or one of the founding scientists talks about is in speed power athletes, measuring things like heart rate variability is a very poor correlate of where their training status is at.
But it seems to be much more relevant for your aerobic or endurance athletes.
Exactly. Yeah. So with your endurance athletes, it's going to give you a really good indication of, okay, the type of endurance work that I'm doing, is it actually having the effect that I want? And is it what kind of, how well are they recovering? And then how well are they able to then be exposed to more stress again? Right? But it's interesting because heart rate variability became this thing that everyone measured. And it's like, it doesn't necessarily give you what you want if it's not suited to the type of activity.
Well, you can actually take that one step further, because I was reading an article recently that was recently published of looking at individualizing training programs for endurance athletes based on a gamut of measures. One of them was looking at heart rate variability. But interestingly, they did talk about, even in endurance athletes, if you just look at heart rate variability alone, it's not a good indicator for how you should adjust training loads. But they looked at some subjective measures as well. So the big ones were like their own level of fatigue and muscle soreness. So when you included an objective measure and a subjective measure,
you got a better, more accurate picture.
Well, yes, and what they actually found specifically is you looked at the tailored program versus just the generic program group. Overall, there was typically a better response in terms of improvements in cardiovascular output. But what I found interesting, and this I think is more relevant, is you had more people who were high responders to the tailored program and less people who were low responders. And I think that's where people sometimes get caught out with, say, some of the acute to chronic workload ratio is, I have no doubt that on average you're going to see less injury incidents with monitoring the acute to chronic workload of a group. But the problem is you're going to have individual variability. And the issue that you're going to have is you're going to have some people who don't respond to the training because it's not appropriate to that individual's phenotype in addition to things like their training history, but you're also still going to have people that do get injured because it's not the only factor that's involved.
Yeah, and that's the key thing that we're trying to do with something like this Omega Wave system is see, okay, at that time, irrespective of what training load we've actually exposed them to, are they responding in a way that we would expect? And if not, then what do we need to do to adapt that to get the system in a position that it is able to respond appropriately?
So what do you actually do with the data? If you see someone's DC, isn't it DC?
So, yeah, so like, okay, so let's go back to that actually to explain. The other part that it measures, which I think is probably more relevant for speed power athletes, and it's important for the skill acquisition side of things, and it's important for how much brainwave activity they're able to produce, or what the way that one of the scientists explained it. They measure something called direct current, and direct current to me seems to be the best correlate of whether my guys feel good and whether they feel ready to actually do, say, a high intensity session. And what that tends to measure is actually how responsive your system is to stress. So is your system ready to actually tolerate a lot of stress or not so?
Okay.
Right? And that, as we know, in terms of stress, it's a sensory motor stress, right? So it's obviously things that have high perceptual input, have high output in terms of like motor output, and that combination leads to coordination of things like high speed, high velocity, high power movements.
Yeah, okay, because we actually haven't talked about this, but I assumed it was related to if your central nervous system is impaired or dampened, so it's going to reduce neural output, and typically what the thing you're going to see mainly is related to discharge frequency, which particularly for speed power athletes is very important for
it does
high
do that,
contraction
but
rate.
what's really interesting about it is it's probably a bit more broad in the sense that it gives you the opportunity to know, okay, if I actually pile up particularly high intensity stress on this athlete, are they actually in a position to receive this and adapt positively from it?
Yeah, okay.
Because if those readings are low, if you're throwing, as you said, if you're throwing high intensity training or high intensity competition on a really dampened system, the response is not going to be, it's not going to be growth, it's probably going to be deterioration or injury.
Yeah, and that makes a lot of sense too when you think about the importance of coordination like in general, but particularly for speed athletes, where if that becomes impaired and they start to change their movement patterns or start to have less complex movement patterns, they're going to potentially overload certain tissue within the kinetic chain as opposed to...
And then that's when you see injuries. And people say like, oh, why did someone get injured, when they did those multiple bouts of high intensity training or competitions too close together? And it's like, it's really clear. Coaches for the longest time, particularly in speed power, and I think the person that spoke about this the most, particularly in the Western world, was Charlie Francis. The famous or infamous Canadian coach who coached Ben Johnson. Now, he was heavily criticised, obviously, because of the involvement with drugs, but he was a very, very intelligent coach and a very, very intelligent person. And he kind of started to bring across a lot of the ideas that came from the Eastern Bloc, ideas that East Germany and the Soviets had been talking about for a long time, which was measuring a lot of these things. And interestingly, like this Omega Wave system actually came out of a lot of the data that came from the Soviets, where they were measuring these things in the 50s and 60s. They were looking at brainwave activity. They were looking at things like heart rate variability. And whilst, yes, they were using drugs, they were actually pushing the envelope in lots of areas, which I think doesn't get respected enough. Because the idea is, well, they were just on drugs, and that's the only reason they were good. And it's like
probably a lot of them were back then, anyway. Yeah,
yeah, they were, but it doesn't. It's not as simple as that. They were doing a lot of things correctly.
Yeah,
and it actually one of the examples of that is the difference between the East German women and the East German men. Right? They were doing the same drugs, but the coaches were slightly like the coaches that they used were different, and the East German women got a lot more success than the East German men.
All right,
right. Which wasn't necessarily the case in Russia. Russia had success on both sides. So it suggests that there is a coaching aspect to it, and there is a more nuanced sports science and preparation aspect to it that I don't know exactly how they were structuring it, but for whatever reason, they actually got a lot more success with the East German women, which suggests that it's not as simple as just load people up on drugs, because I'm sure that the East German men were doing a very similar probably drug protocol. I don't know enough about it, and there's been some books and things which I'm sure at some stage I'll get to get some better understanding of the actual history of it. But I think that's interesting because what it brings forth is some of these concepts of you asked how do you even work with that, and the way that you work with that is you take those measures of things like DC potential, and you put it with, as you mentioned before, the subjective view of what's going on. So you talk to the athlete, how are you feeling? Yeah, I feel good. How did you sleep? Yeah, I slept well. Did you feel rested? Yep, I've eaten well. I've done this. I'm feeling pretty good. I'm not feeling sore anywhere. I'm not tight. I feel like I can actually go pretty fast today. So cool. That reading with this actually matching up gives you an idea of, okay, we can probably push it a little bit today. We can really push the pace. And it's not that if the readings are, I would say if the readings are moderate, I will wait to see what the athlete tells me. And there's been lots of sessions where the readings are moderate and they will still do a very, very high class session. And it's like, okay, they don't need to be in, absolute peak preparedness to be able to put together that kind of training, right? But what you tend to see is then it dampens the system for longer. So the recovery patterning is slower. And you just got to play with that. If the system is really, really depleted and those numbers are coming up, you want to be really, really confident that they're saying, no, I feel really good. And you're trying to be, it's hard because you're trying to be as objective as you can with what you see. You don't want to be biased either way of going, the numbers look bad, so what they're doing, the way they're moving, the way they're warming up looks, poor or this or that. And you're also not trying to go the other way, being like, oh, no, well, they're saying they're good, so I think I can, they're influencing you to be like, no, we can push this. That's a hard thing to do at times. And sometimes what you need to do is put in your own little objective measures. Sometimes you'll do things like, sometimes we'll do some jump stuff before training, and that kind of gives you an idea of like, are they on or are they off?
Just in terms of like the speed of movement, contacts, all that
or even
stuff.
For instance, like you'll see it with the guys in the gym. You're in here when they're doing a gym, say over Saturday, and I don't know if you've noticed, like when they're warming up to do squats, they'll use the measures to go like, oh, I'm on today or I'm not on today. And it's a similar thing, like I'll watch what they're doing in terms of what they're starting to do on the track, and it's like, okay, they look like they're on. And then if they're reporting, I feel good, and the numbers that I've had them collect are good, and it's like, okay, this is giving us a picture, right? Now, it doesn't mean that everything's perfect, but you start to have to be able to play these real-time scenarios through your head consistently. And I think that's exactly what you're getting to about the difference between tailoring something to the individual and having something that's based on the average of the group. I think one of the things that sometimes my athletes find hard, and also when external people come and spend time with us, they struggle with the concept that like we'll have 10 people on the track and we'll have 8 different sessions going at the same time. Yet they all do a lot of events that cross over. And it's like, why do you have so many different things? And it's, maybe I've drunk the Kool-Aid too much with individualization, but I'm trying to optimize what's good for that person. And that's the concept that I think is hard to do because it's obviously time consuming. And when you're actually out on the field or the track, it's really difficult to be able to monitor that and look at what's going on. And okay, you go, you stop, wait for this person. All right, you two are going. And you're constantly trying to pair people up to do things together because you want that level of competitiveness, but it's a challenge. And, I mentioned yesterday that discussion that I had with one of my mentors. I was talking to him yesterday, and he was saying like his style is much more where he really likes people working together. He really likes that atmosphere of trying to create this sort of competitive environment, and he's really trying to foster that. I said, well, what does that mean for the people who are, say, and he tends to sort of create almost a hierarchy in his group, sort of like there's the top dog, and then the people kind of learn from the top person.
The rookies and all this,
yeah. And it works really, really well, I think, in certain ways, much more than the system that maybe I use in the dynamics of my group. But it creates its inherent problem, which is you probably then have to recruit people who fit the profile of what you try to do. And you probably have to get them young so that their system is very, very open to adapting to that style of training.
Well, I was about to say, part of that is also personalities then too, then, isn't it?
Yeah, it is.
But I think also what you're highlighting here is load, whether we're thinking about like physical load or even when we think about non-physical factors that determine your recovery or readiness, is influenced by so many other things. Like, for instance, phenotype is a big one. I know we've talked about this before, but we see clearly some disparity on individuals' response to training loads based on, say, their muscle typology. And I know that this is something that we've talked about before, and you even see it within speed athletes where even though you've got mainly short sprinters or short distance sprinters, there's a variation in that more ultra-fast twitch versus, say, that more hybrid type. And so if you're not taking those things into consideration, you start to see variation in their response. I mean, that's something that I know you've talked a lot about.
Yeah, it is interesting, and you just have to be willing to kind of consistently observe what's going on and consistently monitor that. I think that's the big challenge for people who are working in, whether it's in a clinical setting or even in a team setting particularly, because you've got so many people that you're trying to get information about. And, you know, in the next couple of weeks, we've got some really good sports professionals coming on, and I'm really interested to kind of pick their brain about how they're trying to create an understanding of this kind of problem, because to me, I personally at the moment don't see any way around it other than really individualizing what you're doing, or at a minimum at least profiling down to subgroups that are similar and having those groups kind of work together.
How much autonomy do you give the athletes themselves? Or is that really dependent on their personality again?
I think a lot of it's got to do with age, you know, their general maturity, how much they want to be engaged, like with personality, like how much they actually want to be engaged in that process.
I guess that also then influences how much you utilise their own subjective perceptions into determining what's appropriate or what's not appropriate. Like, do they have the maturity to make good decisions?
That's one of the biggest problems that you have with subjective measures, whether they be in person or whether they're something like, you know, an RPE scale, or whether they are like a questionnaire. They can be fantastic if the person's not lying, right? And athletes are super motivated. You know, like they'll do things that you think like you're actually a bit out there with what you're trying to do here. And they want to train. Well, most of them want to train pretty consistently. So, and they don't like failing. So they don't want to have sessions where like, I can't do that. Even if they're clearly really tired and they know they're tired and they know it's not to do with training or whatever, they still want to do it. Yeah. So it's a real challenge that you have to kind of manage that. And like one of the ways that has been helpful, that's one of the things that the Megawave has been helpful with. It's like I can preempt how they're going to feel. Now, that in itself is an issue because it can actually heavily influence what the athlete thinks. If the numbers aren't good, then they start going, well, maybe I'm not feeling good. Maybe I didn't sleep well. Maybe I am stressed. But it's really interesting. Like, so to manage some of that, at times we won't measure because I don't want them to actually get worried about what that is. And sometimes typically we will do that a couple of days. If the measures are starting to track in the right direction, say in the competition week, we won't measure the couple of days leading into the comp because I don't want it to influence what they think, right? So as long as, you know, earlier in the week it's like, okay, it's starting to look good. It's like, okay, you don't have to measure anymore for this next couple of days because I don't want them thinking, oh, what's the score?
Do you think then that as we get more wearable technology and we can start to quantify certain objective measures in addition to subjective measures, that we could create some type of algorithm to integrate all this knowledge in, whether it's both subjective and objective, determine, all right, this is your state, this is what we're going to do today? Or do you think that in itself is misleading because you're assuming that there's always, stability in the system and therefore accuracy in the algorithm that you use? I
think we will be able to do something like that. It needs to obviously be able to work to that individual, right? So it's not what the particular scores are on certain things, because even with the athletes that I work with, a good score for this person might be, I'll just make a number up, it doesn't matter even what it is, so like 10. but a good score for the other person is 25. You know, like those don't really seem to matter if that score is good for them, and that when they get that, they start to actually put together good sessions or whatever it is. That's always sort of super helpful. So it's hard, I think, to maybe create something that is able to fit all of those, and how you would maybe have to track certain subjective measures for those individuals would be an interesting game. I don't know how you could create.
Well, can you have like, you know, your own sort of bandwidth for individuals?
Yeah. It's just that I don't know how you would, like, I don't know how to program. I don't know how that would work. I'm thinking about the actual engineering, you know, software engineering conundrum of how you would program that. But I think that would be an interesting game. Like an example I would give to that, because maybe this is a better example so it's not confusing for people, is the things that will help someone respond well, say on their, you know, and again, I'll go back and use the Megawave. Obviously, people have different systems they use, and even some of my athletes do heart rate variability as their score because they're not doing the Megawave system. But the things that boost scores for one person may be the complete opposite of what boosts scores for another. And that comes down to that profile thing. So one of my athletes, who's probably one of my faster athletes, if they don't do something that has intensity in it, their scores go down, right? If they do too much of it, their scores go down. But if they do not enough, we've done like lower intensity training items for a few days. And it's always really interesting, like in the rest weeks, their scores are actually lower than when they are sometimes in the middle of their heavy weeks. Which is not surprising, I think, because your system starts to say, okay, well, we can start shutting down some of the output for this.
But it's interesting because that's very counterintuitive to how most people look at things like tapering, of as you reduce your training load, subjectively you feel better.
Well, it's about, and I had this conversation, you know, I keep referring to him, and we are getting on the podcast, so apologies for always referring to, but talking to the VAS physiologist, you know, he said to me, you know, I think too many people make mistakes in their recovery weeks or rest weeks because they don't use the data that's there from the tapering research. I said, well, what do you mean? He said, well, are you aware of the tapering research? And I said, yeah, most of it's been done in endurance training, but, you know, particularly Indigo Majika, I don't know how to say it, but is the person that's done an enormous amount of awesome work. It's mostly been in swimming, cycling, running, distance, endurance stuff. But basically what is shown consistently is maintain the density, maintain the intensity, but reduce the volume. And reducing the volume is just based on what that individual profile. So some people only need maybe a 25 or a third reduction. Some people need 50%. Some people need 60%, whatever it is. Some people like more or less. But don't change the training. And don't change the structure. So one of the things that he mentioned to me is I see too many coaches who in their recovery weeks will change the actual look of the week, will change the training completely, will change the intensities a lot. And he said what we see is all these measures go all over the place. And that's really obvious to me why.
Well, but say I'm assuming a lot of that relates to expectations even for the individual too.
Yeah.
Because I mean, like, it's that concept we've talked about before of allostatic load, where you're always preparing yourself psychologically and physiologically for the upcoming stress, where if that changes, even if you did it on a different day, it's in a similar training stimulus, it's actually a stressor in itself because you're all of a sudden having to change your schedule and routine. Yeah.
And I think that stuff is, you know, we've spoken before about someone like John Kyler. He talks a lot about this idea of expectation, and how that influences really heavily how you perceive what's happening, what you perceive to be the benefits of what you're doing or the negative side of what's coming ahead, and even how physiologically you're going to respond or, as you just mentioned, prepare for that kind of exposure. Yeah. And those kind of things are really, really important. And I've been thinking, you know, we've been doing some upskilling of a staff member that's about to come on for the new year, and I've been thinking a lot about sort of some of the education that I think we need to do around return to sport planning and, you know, developing rehab plans. And one of the things that I like to do a lot, and it's very much for this reason, is keep the same structure for that person, right? Even if they can't, say, run, or they can't jump or whatever it is, on those days they do similar things to what they normally do. So if your footy training is Tuesday, Thursday, you play on Saturdays, they should be the main rehab days that you have, right? So they might be you might be able to do some skill work, but you're not going to play or whatever it is. But those are the days that you go and kick the football. Those are the days you do your running. Those are the days you do skill work. On the other days, when you normally do some gym or you normally do some other conditioning, those are the days you do that. And so when you're managing, say, someone's load, say if let's use an example of someone coming back from a stress fracture or something like that playing footy, what you need to be doing is saying, okay, how do I structure the rehab so it looks similar to what they do? So if they're doing, say Monday night they do conditioning type work, they're usually going for a run and they're doing intervals, put them on the bike and do that, or in the pool. And then the same day they do some upper body gym. Great. The next day they usually do footy skills. So you say to them, okay, you can't do a lot of running, but you can go and do skill work, right? Go do lots of handball work, go do some short kicking, stationary stuff, but you can do that. As long as you're not jumping and you're not doing lots of running, we're happy with that. And you keep that same structure throughout the week. And the reason that that's important, as you said, is not so much this management of acute to chronic workload stuff, even though it addresses those things.
Yeah.
It's what you mentioned. It's like you're creating this environment where they know what the expectation is and their system is preparing for the stress in the way that it's going to be exposed when it needs to be in its actual sport.
Well, and you can think about it from a simple perspective. I'm sure a lot of people have had this experience where, let's say for whatever reason you have to get up early the next morning. It's out of your typical routine. But sometimes you're stressing about it. You don't sleep that well that night, and you get up and you go, "Shit, I just had a horrible sleep." And it's like, what is it? Well, I was thinking about the fact that I have to get up at 5:30 in the morning.
It's always funny that, I know, so when you got to go to the airport, and you always feel like you're going to miss your alarm or something, and you keep waking up really early. Almost checking the time. So I think those things are the important things that relate to monitoring and why it's important.
Well, while on that, because we've been a little bit critical of thinking of some of the acute to chronic workload ratio.
Well, I would say it's not being critical. It's being aware of where it sits in the management of whether it be injury or even performance. I think you have to put it into context of, as you mentioned, other measures. Well, it can't be the only thing.
Yeah, no, you can't silo this stuff.
Doesn't mean it's bad by any means. It's a really important feature of monitoring. It's just not the only feature.
And interestingly enough, if we look at what are the gold standard measures, in short, there isn't any particular one. But I know there was a systematic review published in the British Journal of Sports Medicine in 2016 when they looked at all the different measures that people use, both objective and subjective. And time and again, subjective triumphs objective when you look at the actual individual studies. And that in itself says a lot, because why is it that subjective measures are better? Well, because it's based on the individual's perception, which is going to be based on so many different things.
Yeah, well, and that's that idea of predictive coding. You use what you believe to be happening and what you expect to happen to alter that physiological state. And there's a really good, for those people who are interested in some of this stuff, I think we have mentioned it before, but there's a really good Science of Sport podcast that Ross Tucker does with John Kiley. He talks about this idea of predictive coding and what that means. And he said, one of the examples they use is, if you're walking out in the bush and you see something up ahead and you hear a noise and it looks like a long, thin structure, you think, oh shit, it's a snake. Your heart rate will go through the roof. Yeah. As you get closer and it's not moving, you realize it's a stick, right? The objective reality that it's a stick has nothing to do with how you respond to it or the way in which your system prepares for that task. And I think that's a perfect example of what you're saying, because it doesn't matter what the objective measures say. It doesn't matter how much external load you've undertaken, whether you've done lots of training or you haven't done lots of training, and your acute to chronic workload ratio might be perfect. If you perceive that you're tired, then you will probably perform as if you're tired. If you perceive that you're not tired, you will perform as if you're not tired.
You make me think of a study. This might seem a little bit left field, but the snake.
There's nothing left field with us.
Yeah. Of if you're walking out in nature with someone and the person next to you yawns, you start getting an upregulation of your stress system. And when they found this, they're going, what the hell why is someone's stress system getting upregulated from someone yawning? And it actually has to do from a survival perspective, where if you're in nature and someone's yawning, you're thinking their perception's down. I need to be on alert because if there's something around here that's going to take us out, old mate's not going to help them. And that might seem actually it actually is relevant in the sense of there are environmental factors too that influence your state of stress and therefore your response to what's going on, particularly like in terms of a physical stressor itself. But I think the other thing too that people get caught out on with this stuff is plenty of people have tried to create these algorithms to predict injury. And
they keep failing, and that's one of the things that people are really struggling with because they're using all of these very, very sophisticated computer modeling simulations, and they don't seem to be able to predict the injuries.
No, and that's the issue here is it's not about predictability, it's about probability. And the other thing with that too is when you're making a decision, as a coach, as a clinician, you've got to think about opportunity versus risk. And I think that's where other people get caught out because for instance, if someone's objective measure, whether it's their DC measure or their heart rate variability is off, it's indicating that this is out of normal, what do I do? If you just base it purely off that, you potentially miss an opportunity.
Yeah, it's opportunity cost, isn't it?
Totally. And it's always easy to take the conservative route and go, you know what, we're going to do nothing or we're going to reduce things.
I think the reason that it probably comes across as us being a little bit critical of the acute to chronic workload ratio is it allowed particularly conservative clinicians to justify their bullshit conservatism.
Absolutely. Well, it's
especially in a high performance environment.
And this is where it's really important because in a high performance environment, you as a group,
you have to find little opportunities to continue to improve.
Absolutely. I mean, no one gets better or achieves greatness by avoiding or minimizing the input that they need to do to achieve the result that they want.
And that's something that I think, is interesting because I think this is something that will start to get a lot more popular, and we've seen some of, I hate the fucking term because it's stupid, in rehab, like introducing chaos. It's not chaos in any way because you fucking planned it.
It's not random,
Yeah. Chaos would be, an elephant fucking storms the pitch. Right?
Throw a snake at them and say, deal with this.
Fucking idiots, right? So I hate the term chaos.
Yeah.
But you're increasing the amount of complexity, you're increasing the amount of stresses that are, possibly going to expose them to. Chaos is not that. You're not taking them hostage and then saying like, all right, how's your stress management now? So what I think is important though is how do we actually create those, as you said, opportunities for growth and opportunities for athletes and or patients to feel comfortable to take risk.
Yeah, absolutely.
Because risk is where the growth is.
Well, and look, they're not different things. I mean, from an elite athlete's perspective, you need to give them every opportunity to continue to develop because there are only so many opportunities that they have. Where on the other end of the spectrum, particularly with, say, the general population, you have to realise that most of the time that people present with pathology or pain is because of the lack of risk that they're taking. Well, it doesn't even have to be risk, but the
lack of stress that being
lack of stress and input. Yeah. So really, I mean, we talk about this too when you think about someone who's sedentary and has poor health markers. We're still applying the same process of how do we maximise the stress to this system to get positive adaptation, but also making sure that based on individual factors, we're not overstressing or we get an adverse or a negative response. But it's still the same process that applies. And it's something I was going to bring up before later, but I'll bring it up now, is I know clinically it's something I always find interesting to play around with, where if you prescribe someone an exercise and you say, all right, I want you to do 3 sets of maximum repetitions of that exercise. And sometimes I look at you going, like, how many, what do you mean max? I go, max, like until you reach muscular failure, until you can't do any more. And it's funny, I realise there are some people you can't do that to because they don't actually have the ability to take themselves to that point yet. But at the same time too, you know, if you're just saying, I want you to do 3 by 8, like how do you know that that's going to be an effective stimulus for them in terms of getting them as close proximity to stress in their system as maximal as possible? I mean, that's a challenge in and of itself, but I think you need to try and determine what is that point in terms of how much stress someone can tolerate to maximize adaptation.
And I think we've mentioned this before, but I think that as someone is exposed to more stress, they get much better at being able to identify what actually is a stressful stimulus and what is not.
And make them realise it's actually okay to go to that point. Because I think that's the other thing that people miss out on, is thinking, is that okay to do? Because people aren't used to pushing themselves out of their comfort zone.
Well, it's interesting though, because I think you do tend to see that changes really quickly. Like you see these people that almost get addicted to exercise.
Oh, that's true.
They go on, even if it's a community level, they're doing exercise classes 5, 6, 7 days a week. And you're like, why are you going somewhere? Like, I just love it. I just love pushing myself. I love actually trying to do a hard session. So, as much as I think it is something that people at the start maybe push against, once they realize actually the benefits of doing that, they start to run towards it.
One thing I want to go back to, which when we're talking about training loads, is how do you utilize that in your coaching? Because I'm assuming you're looking at how much training that they're actually doing, yes?
Yeah.
Do you look at trying to change their training loads each week by a certain percentage, or how do you structure it yourself?
Yeah, I know that people always talk about this concept of how you change loads no more than 10% per week and all this kind of thing. I think that that's only useful if you're using, probably a coaching or even like a periodization style that is more linear in nature.
Yeah, okay.
The application of volume. I don't tend to prescribe training in that way, so managing loads is not really something that I tend to have a massive amount of issues with, other than sometimes the intensity goes higher than you actually would like them to go. The thing that I tend to often be having to try and control is intensities, not volumes. So for me, I'm not necessarily measuring volumes. I'm probably measuring more a correlate of how much that volume is multiplied by the intensity that they worked at. Right?
Are you looking at that through some of the objective measures that you collect?
Yeah, it's I'm always collecting times for basically everything everyone does.
Sure.
I'm collecting distances if they're doing jumps. I'm collecting, in the gym, like what's happening with the actual force output or the power output that they're creating. So I'm seeing these measures and kind of getting an idea of if someone goes to a new level with a squat or they go to a new level in an 80-meter rep, that's time for me to start thinking about, do I need to manipulate what's happening with the amount of volume that I do on that day and then in the consequent days, weeks. It's one of those things. And something like the Megawave system has allowed me to really understand, okay, if someone goes to a really high level and you do a bit of volume of that, you're going to need to change things for a while. And there's a few interesting stories about that, and some of them they're almost like folklore, which I think is important to put out there because it's not something that you necessarily need to attach to. But if you speak to some of the coaches that work in those speed power events, they'll talk about concepts like if someone does quite a big, say, personal best, they may be struggling to be able to recover from, and they say central nervous system. I don't know that they're measuring these things. If they are using systems like we're starting to see be available, then maybe they are taking these measures. But I think it's a combination of biochemical markers that do change.
Yeah, which probably influence central system capacity.
Definitely. Yeah. But they talk about anywhere from 10 days up to sort of 21 days of reduced system function and output. And an example of that is, for those who are interested, I believe the talks are still up. There's a track coach in the UK called Steve Fudge, and he coached a guy called James DeSolu, who was a sprinter. And James had this history of lots of injuries, talented but lots of injuries, and the performance was sort of a bit all over the place. And they took this approach with him of they really reduced his volumes down and built him up really slowly and kind of attacked it in that manner. And they were able to get some really good performances out of him. One of them is, and it's still his P, or he's retired now, but his PB, and he ran 9:91. And at the time, this was in 2013 that he did that, I believe. And what they did was they were measuring his testosterone and cortisol ratios using saliva testing at that time. But they weren't getting the results back for 2 or 3 weeks after the actual collection. And what they found was after he did that, his saliva readings didn't improve for about 3 weeks. And that's a hard thing because, one, you're not receiving the data straight away.
Yeah.
But two, if you go and have a performance like that, you sometimes have to consider, okay, well, did I place that in the correct sort of position with when I expose that athlete to that stressor? You know, before we mentioned opportunities and opportunity costs, it's like, be aware that if you expose someone to something that is new or really foreign or way beyond what they've done, what impact that might have. And it's not to say that you can't have someone run multiple personal bests and all that kind of thing in a season, or have, you know, multiple personal bests in the gym. What it means is you just need to be very aware of what you do around that and how you build them back up, because the stress that it does expose them to is quite significant, or maybe quite significant depending on the individual.
The thing there too that I remember when you first told me that story, the thing that stood out to me the most is how much intensity can stress your system. And I think that's one of the big things that people forget about as well, where we're so used to looking at things like volume. And I think we always associate with, well, you know, typically if you're a distance runner and you're doing lots of volume, you're typically going to feel a lot of fatigue. But people often neglect how intensity is such a big factor. It's probably interesting something too, I know we've talked a little bit about with even training loads, of how much are you actually measuring training loads based on different velocities, in terms of different velocity brackets or parameters that you're running in.
Yeah.
Because it seems that, you know, you get to a certain point and even if they're not running a lot, the magnitude of the stress is far greater than what people would actually give.
Yeah, well, on that, which is very funny. At the moment, I'm helping out a FIFA referee. She's an absolute legend. You know, she is wanting to get faster because she's actually planning to be doing some reffing for both men's and women's competitions. She's done that before. But part of the testing is she actually needs to meet the criteria that they set out, and one of them is the running, and she's got to meet certain speeds, and she's got to do certain tests, right? Which is probably normal for all refereeing or umpiring at an elite level. And so she's been working with me at the moment to work on her speed. We've done a lot of acceleration stuff, and she's picking that up really well, and she knows what she's doing. And she seems to tolerate that pretty well. She can do that, and the next day do conditioning, and she can do some of her ref coaching, ref sort of sessions and all that kind of thing. And then for the first time a couple of weeks ago, I was like, okay, we're going to do some more upright max velocity stuff. We do the session, and then I see her a few days later, and she said, I'm so sore still. This is 3-4 days later. And she's like, I've never been that sore in my life from such a small amount of running.
Yeah.
Because we did 8 runs. And she's like, I've got soreness in places I didn't know I even had on my body. Right? Which, as I said to her, and I tried to, she understood it, and she's really intelligent about this stuff. But we spoke about the concept that intensity is very, very different to volume. You know, people tend to be able to adapt to volume a lot quicker than they can intensity, right? And I think a lot of that's got to do with training history.
Well, and even like culturally, it seems like in Australia we are much more fixated on the idea of volumes that people do, and you see people are much more enamored by the really good marathon runner as opposed to the really good sprinter.
Yeah, and there's lots of reasons for that.
Yeah,
I think it's one of the frustrations, which I think is funny, is in Australia we very highly value hard work. So if we see someone doing well off seemingly not putting in the work or not being prepared, or and I always say to people, like, the worst thing that you can be in Australia is a bludger, right? Because everyone hates you at that point. But interestingly, you have to take a mentality of not thinking about how much you can do, but more what's the optimal amount to do.
Yep.
There's a couple of coaches, but one of the ones that I think heavily influenced me with this, and if anyone's interested, he's a super interesting guy. He talks about a lot of sports performance. He's a Dutch coach named Henk Kronhoff, and he has helped a lot of athletes across a lot of different sports. He helped Mary Pierce in tennis, and he helped Peter van den Hoogenband, the Dutch swimmer. But his main sport has always been athletics. He's sort of come and gone at different times, but had a lot of success, medalists at world and Olympic level, all that kind of thing. But he always talks about this idea that, training is almost like poison. You've got to work out how much you can give the athlete without killing them. And working out how much is the right amount of training, rather than thinking about what's the most amount of training that I can give them.
Yep.
And I think that's the most important thing that monitoring should be used for.
Yeah.
It shouldn't be done without the desire to then implement changes based on what you're seeing, right? But you've got to see it both ways, as you said before. It's not just you're using it to stop someone from doing something. You may actually be using it to enhance or take an opportunity that you wouldn't normally have taken, because you're seeing, okay, subjectively they're telling me that they're good, and all of these features are kind of coming together. Therefore, I can actually maybe change to do more today than what I was going to do, right? And that's where you start looking at different opportunities. And it's interesting, like with him, he coached a Dutch athlete who, ran a personal best at 37, ran like 20.1, a Dutch guy. And he was saying, like, his whole career, this guy, we mentioned before about like athletes aren't always honest with you. This guy would always, every single day that he coached him for years, he was perfect. He felt great. He was ready to go. He could run a PB today, which just wasn't true, obviously. And then when he started, Hank was one of the person that got me onto this Omega stuff, and I started using it a little bit in 2014. It didn't have some of the measures I wanted, but it's improved since then, and now I'm using it with a number of my athletes. But he was saying, like, he was measuring, and he was involved early with their development of it. And he said when he started measuring some of these things, he realized after they had a national championships, and this guy ran the nationals, and he goes, "Oh, I'm actually going to give you 2 days off." Then when he measured him when he came to training on, say that was finished Sunday, he had Monday, Tuesday off, measured him on the Wednesday, he goes, "Optimal recovery." And he was like, "What the fuck? How is this optimal?" And what he realized was, this guy, if you give him something really intense, even if it's, a full competition, if you give him 2 days off, he's great. So the mistake he kept making his whole career up until that point was he would give him 1 day off and think he was recovered. And it wasn't. He said when we really pushed, we had to give him 2 days off. Or into a major comp, we'd give him 2 days off. And then his performance just went like this. And at the age of 37, he ran a lifetime best over 200. And it's like, okay, that's how you individualize the training. And I think that's where you see that monitoring creates opportunities. And that's the area that at the moment, I don't even think I'm there yet, where I'm kind of exploring pushing those opportunities just yet, but I think that's where it should go. I think that should be happening at our level in a clinical setting. Like if you're measuring certain things, and we spoke about this actually in our discussion on safe to fail experiments, right? The difference between a safe to fail experiments and trial and error is you're not picking things from thin air. Right? What you're doing is you're taking a guess in real time. It's almost that Bayesian model of like information comes in and you use it to update what is going on. What you're doing is seeing what you're hearing from the person, seeing what they're doing in terms of their function, and then making that evaluation to say, okay, it's time for us to push this. And that's where in real time you might have already pre-planned, but like if they can do this, I'm going to push them to here. Well, if they can do this, I'm going to push them to there.
I was going to ask then, how often do you find yourself making real-time changes?
All the time.
Yeah, okay.
If you can't make real-time changes, you're fucked. I'm serious. As a coach, you are fucked.
Yeah.
If you think that you can plan ahead of time and not change it, you're in real trouble.
Well, I guess you also, what's the purpose of a coach being there if you're just going to have some...
Well, if you're just writing a program. And what is interesting, even like I brought up Hank, he's such an interesting guy, such a successful coach, and really, really, really intelligent person. And one of the things that he mentioned was he coached an athlete, I think it was the 92 Olympics. Sandra Patrick Farmer's her name. She was a 4-hurdler. She won the silver medal. He was living in Oman at the time, right? And she was in the US. And he was coaching her via correspondence. But the way that he did it was super intelligent. Is every single session that he wrote down for her had an A session, a B session, and a C session. A is you get there, you feel good, you've got no soreness, you've got no this, you've got no that, do that session. B was in between, and C was, I feel like absolute garbage, but I'm not going to do nothing today, so do this. And I think that's a super intelligent way of kind of creating a system around that. And that's typically what I'll do. And I even try and preempt this with some of the athletes. I'd say to them, like, we'll be talking and we go, we're doing this on this day. But if you feel like this, then we're going to change it to that, or we might adapt to this. You always have the ideal, but in real time, you have to change it based on what you're seeing, whether it be subjective, objective, or usually both. You're trying to create that concept, because we've spoken about this so many times, but you're dealing with a complex system that's changing, it's dynamic, everything changes, even in the moment it's changing. And your willingness to be able to adapt to what you're seeing is the most important part, more so than even what you're measuring. Because if you're measuring something and you're not even confident about what's coming back from it, your job is to be able to be willing to change the way you're even perceiving that information. One of the things that I think has been really interesting with something like, and I keep referring to it, but the Omega Wave system, is how my perception of what that's telling me is changed over the course of using it for longer. And that's what I mean by, like, even the information itself changes, right? Because you start getting a much better appreciation for what that number means for that person at that time.
Actually, I think we've talked about this before, but it makes me think about, why does it seem in sport that there is so much appreciation and acceptance of the art of coaching?
There is or there isn't?
There is, but you don't see that in healthcare. It just seems like, when I think of our profession, to have a discussion where you're describing all these things and thinking about the variability and the different factors, there's that often that statement of, where's the evidence? Why don't...
Well, we've spoken about it a million times, and I think it always just comes back to this stupid notion of poor understanding of evidence-based practice.
But what do you think, what is it culturally about coaching where it's actually something that seems to be a common trait in the most successful coaches?
Well, I think
it's probably just because they actually understand what complex adaptive systems are and how you...
Yeah, even without necessarily recognise that they do, because they have to. But also, I think the major reason is because they're there to get a result. And this is the big difference. You and I talk about this a bit, but coaching is the best thing that I've ever done for personal development. It does not matter how right you think you are. It does not matter how
many articles you've got to support
what you've written down as your program. It doesn't matter. If the result doesn't happen, you lose, right? And coaches see this. And that's why, coaching is one of the hardest professions you could ever do. Look at the coaches that are high up, EPL, international football, AFL. If your team doesn't win, it doesn't matter how fucking smart you are or how good of credentials you had prior to starting that job. You will get fired, right? Results matter. And I think in this world, particularly with healthcare, we actually don't drive this notion that getting results matters. And interestingly, we had Paul Coburn on, and he spoke about this. He's like, we don't fucking know what some people do, right? We can't work out why they're so successful in a compensable situation, but they get the results. And that's the important part that I think is a real scourge on healthcare, is that people are so comfortable with themselves and arrogant and egotistical about what they input rather than what comes out. What comes out is way more important than what you put. You might say a couple of nice things to the person and they feel better. Does it matter that all you did was say, I really like how you dressed today? It doesn't. Or you look nice and bright today and happy. And they go, oh yeah, I do. That doesn't and all of a sudden they're like, yeah, my back's been feeling much better. And it's like, that was the most appropriate thing to input right then. Is that input what they're going to teach you? Compliment your patient? No. But if it gets the outcome that you want, it doesn't matter. And that's same with the placebo thing, if you talk to athletes, it's so funny. Athletes couldn't give a stuff if it's a placebo. If they perform better,
patients don't care if it's as long as they feel better.
If they feel better and they got less pain, they don't care.
Yeah.
And I think it's interesting because I think it's changed the way that I kind of approach that as well with patients. I think some patients probably find it funny. They'll ask like, "Oh, do you mind if I do this X, whatever it is, foam rolling, stretching, rolling on a ball, taking, a painkiller, what?" And I just say to them, if hot bath, cold bath, if you feel better, do it.
I'm with you there completely. When people ask, "Oh, should I be doing this? Do you feel good doing it?" Yep. Then
great, keep doing it.
Absolutely. Like, why would you say to someone, "No, there's no evidence for that," or
because you're so arrogant and your ego is so fragile that you think that you have the opportunity and you're the only person that can influence this situation positively. That's why.
We had this conversation recently or privately with Paul when we saw him the other day. We were talking about the way that healthcare is structured at the moment. AI will develop to a point where you actually don't need to have a healthcare person working with a patient if all you're doing is just following protocols. Because the reality is you can program
to show them the protocol. If you do ACL, then do this and then do this.
Not to mention, as you get AI technology developing, you get visual assessment going like these are the things you need to look at. And
but we laughed because we said it's probably never going to work because a human doesn't want to be dealing with that. They want to be dealing with a person.
That's true.
And the other thing that
But why then? Why do they want to deal with a person?
Because the person has the ability to make changes in real time.
And they're personable, and a good person is, I guess, at least.
Maybe not us. Maybe someone else.
Maybe not.
I think, look, we've probably covered everything that we need to.
Yeah, I think so.
Right? But I think the key points are with monitoring is understand that the best monitoring you're going to get is definitely going to come from both subjective and objective.
Yes.
If you start measuring objective stuff, do it over a really long period of time before you start making changes because you need to understand what it means for that individual. And then when you do have some of that information, make sure that you're applying it to that individual to seek out not only opportunities for reducing, say, injury or, performance decrement, but actually opportunities for growth.
And one other thing I think I want to add on is technology is becoming so much more readily available that I think more and more clinicians do need to adopt using technology to collect objective measures. This doesn't need to be, we don't need to just focus purely on subjective measures, not to mention we have access to good equipment now that we can use to collect this kind of information because it is actually really useful.
Oh, yeah.
It's just as long as you're not looking at anything in isolation.
All right. Thank you for joining me, Jack.
Thank you, John.
All right. Thank you for listening. If you enjoyed this, obviously make sure to subscribe, share, like, whatever you're supposed to do with all that stuff. We really appreciate you listening. Any feedback that you can give us is always super helpful.